Thank you, and welcome to our listeners around the world. My name is Neil Seaman, and for those of you who don't know, the vision of the Quiet Voices podcast is to reveal data unheard and stories untold on the most pressing issues of our time that require data and objectivity. So I'm going to ask my illustrious guests to each introduce themselves and share the one thing that first made you aware of the urgency of fighting the stigma associated with substance use and people in recovery. So I'll invite Jules, please, first. Thank you.
Thank you, and thank you so much for having me this afternoon. My name is Jules Netherland. I am the Managing Director of the Department of Research and Academic Engagement at the Drug Policy Alliance, which is a national organization in the US working to end the war on drugs. And wow, that's quite a question, but I would say I think the first time I really was impacted profoundly by stigma related to drug use was when I was working in a soup kitchen in neighborhood of Philadelphia towards the end of the crack era. And I remember working with a young woman who had an abscess so severe on her leg from injection drug use that her leg was actually turning gangrenous. And she was unwilling and afraid to go to the hospital because of the treatment she had received there, and ended up getting very, very sick and ultimately dying, not from her drug use, but from that infection, because she felt so incredibly unwelcome in a healthcare system that was supposed to help her.
Thank you, Jules. Wow, that's really touching and alarming and insightful. Akwasi, over to you, please.
Thank you for the invitation to be here, Neil, and it's great joining the guests. My name is Awasia Wusubenpa. I'm a professor in the Department of Sociology at the University of Toronto, and wear a few different hats related to what we're talking about today. I'm the Director of Research for Cannabis Amnesty, a not-for-profit seeking to clear the records of people criminalized for cannabis-related offenses. I'm an affiliate scientist at the Center for Addiction and Mental Health in Canada, and I'm also the race equity lead for the Center on Drug Policy Evaluation. As Jules noted, this is a big question. I think for me, the realization of the impact of stigma on people who use substances actually came very early in my preteen years. In fact, I became kind of aware of drug use and the problems associated with drug use as a result of what I saw in the streets around where I lived in Bristol in England in the early and mid 1990s. And at that time, Bristol was dealing with both a bit of a crack epidemic as well as problems related to the use of heroin. And I would see needles on the streets. I would see people that were clearly, we describe as strung out. And I remember a commercial coming on TV, and it was really around the stigma piece, and it had the song, "He ain't heavy, he's my brother." And in the commercial, it told the story of someone who lost their brother to substance use, and it was really actually trying to battle the stigma. And that commercial stuck with me my entire life, and I don't think I actually really understood what it was about until I started studying drugs and drug policy as an undergraduate student. But it's always stuck with me and kind of guides some of the work that I do.
Thank you, Akwasi. Sean.
Great. Thanks so much, Neil, for having me here. And I'm really excited and honored to be with the two guests that are here today. My name is Sean Fogler. I am a co-founder of Elevist, a public health consulting group. And we do a lot of different work in the harm reduction space around substance use disorders, and many of the strategies and ways to manage this disease and policy related issues. We work with a bunch of different groups in healthcare, criminal justice and law enforcement groups. We do a lot of advocacy work. For me, I'm a person in long-term recovery. I've been in recovery almost 7 years, which is pretty miraculous. I'm also a physician. I practiced medicine for about a decade. And to be honest, I had no idea of the impact of stigma, the criminalization of this disease till I myself was criminalized, till I was arrested for drug-related offenses. It's interesting because I got into recovery in 2015, And I was arrested a year and a half later for drug offenses. And as much judgment and shame that I experienced getting into recovery, which really was small relative to my experience once I was criminalized and shamed and stigmatized in the media. And there's nothing worse. And my substance use disorder was rooted in trauma. You know, I was at the World Trade Center during the 9/11 attacks. And really the criminalization was far worse than even that experience. And that got my attention. It's unbelievable because I was, you know, I had been practicing medicine for almost 15 years in inner city hospitals in Philadelphia, seeing patients with substance use disorder and having little to no awareness of the impact of stigma and discrimination that existed, you know, until I myself was impacted.
Sean, thank you. Thank you for sharing your story. Starting with you, Jules, and then we'll go to Awasia and Sean. Can you share with us one perspective on substance use and stigma that you feel is missing from the policy debate today and requires immediate attention from researchers and policymakers?
Well, sure. I think I want to sort of address something that Sean alluded to, that stigma, while is experienced sort of on the individual level, is really rooted in and supported by the policy decisions that we make, right? So criminalization is certainly an example. So criminalizing people who use drugs certainly perpetuates stigma on a profound scale, but it also infiltrates our policies in child welfare and employment, the way we drug test people or penalize them for having a drug arrest or conviction. It's in our housing policies. So we have a number of policies across arenas that reinforce the idea that people who use drugs are bad, that they're irresponsible, that they're unworthy, that they can't make good choices for themselves. And these policies often equate any illicit drug use with a problem, even though we know that many people are able to quit or moderate use on their own, and that certainly many people who use drugs are not irrational or out of control, right? So a lot of drug use is completely rational. People use drugs for pleasure, for coping, for self-medication, sometimes for enhancement. But we tend to have this cultural notion that is reinforced by these structures and policies that drugs are all bad, and that people who use drugs are all bad. So what I'm really interested in seeing is research and policy advocacy that looks at the structural underpinnings of stigma rather than trying to address it just on the individual level.
Thank you, Jules. And Sean, in answering this, I'm wondering if you can pick up on the recent research and data you've been involved in on social stigma as it relates to substance use, and if there was anything alarming to you or surprising to you in those data. If you can maybe tell us a little bit about that study and what you learned in the process of that, or what it validated for you.
Right. Well, first of all, I mean, I agree wholeheartedly with both Jules and Awasia. You know, our policies are directed to a very, very small percentage of people with extreme substance use disorder, and that's just not the norm. And I always say it's not about the drugs, like the overdose crisis, this thing we call the opioid epidemic, which really is not a good label. I mean, it is not about substances. It's about our policies, and it's about these underlying root causes that we continue to just ignore, right? And if you look, you know, over the years, we've used mass incarceration, we've used these, you know, racialized drug policy to battle a public health condition, and really to label, you know, and discriminate against people and destroy communities. We found, you know, in our pilot study, and the impetus for the study was really not only my personal experience with stigma, but other people in recovery, other people I know that continue to use substances, and the judgment and the shame and the discrimination that they experienced, and looking around and seeing all these different campaigns that are well-intentioned to address stigma, and me asking myself the question, like, are we really helping? Are we hurting? Is any of this stuff working? And I really felt that it wasn't. I'm not to say that some things are not working, but I just, I didn't believe it, and I wanted to find a way to measure it, and that was kind of the impetus for this study, and to use the technology, ReWe technology, to get these large population sample sizes, to get a generalized picture of attitudes towards people that use drugs and people in recovery in this country. And the findings were really eye-opening. I mean, some of the things. The in-group, out-group status, where we found, over 70% of people don't believe that individuals that use substances problematically are part of their communities. And the reality is they are part of our communities, like they are us. They are in every corner of our society. I mean, I'm on this committee at a university in Center City, Philadelphia, a very prestigious place. And they say that these people aren't here. We don't want to open an MAT clinic because these people, I'm like, these people are in your hospital. Kensington's 2 miles up the road. It's the epicenter of the overdose crisis. They're everywhere, right? They're doctors, they're lawyers, and I love that Akwasi talked about Carl Hart, because I love his book and I love what he's trying to do. And the reality is we will never rid society of substances. They are here. And so when do we start shifting to let's protect people, protect their health, give them the information and strategies to live, self-directed lives, like healthy, productive lives. And that in-group, out-group status really stunned me because it's this idea that it's not us, it doesn't affect us, this isn't me, this isn't my family, but it's everywhere. Like it really is everywhere. And so that was one of the shocking, there's so much data that we pulled out here. I think some of the things around blame and responsibility are really important because we know, from research that if we believe that somebody's caused their quote unquote disease or issue and we believe they can control it, stigma's off the charts, right? I mean, somebody who's got cancer, we don't look at the same way, right? We love them, support them, we give them resources. When it comes to drug use, we don't, and that's something that's got to change. So those are a couple things that, couple things from the initial pilot that stand out to me.
Thank you, Sean. Akwasi, I know that data is a big part of your life and your research. In the course of your book writing, your university work, is there any type of data that you feel is really important to gather, to investigate further, to advance our understanding of this issue? Thank you.
Yeah, thank you. So I do a lot of qualitative work, and I do some mixed methods work. I'm not much of a quantitative, strong quantitative researcher myself, but I recognize that primacy in numbers. And so, part of what I really, really appreciate with respect to what you're able to do at ReWe with this work is get these numbers, and you can get a lot of numbers, right? And I think numbers are powerful when it comes to going to policymakers and trying to affect change and to affect public perceptions. One of the things that I think is extremely important as well are the stories, right? Sean's shared a little bit about his story already. He's mentioned, that his substance use was rooted in trauma. When we look at people like Gabor Mate, who's done a lot of writing on people in the downtown east side of Vancouver and their troubles with substance use and substance use disorder, and how rooted in trauma those of course are, and what those stories of trauma are, I think that those are very, very important. I recently finished some work here with the Mental Health Commission of Canada, and we were looking at the perspectives, Black Canadians' perspectives on cannabis legalization, and what we still need, and especially from a research perspective. And a lot came out about the stigma of cannabis in Black communities. I think many people, especially Toronto itself, Canada has very old Black communities, but we also have more recent immigrants, and there's a large Caribbean community and a large Jamaican community. And so a lot of people will associate cannabis use with Jamaicans and with Rastafarians, not recognizing the deep stigma towards cannabis use, for example, that exists within Jamaican society. And so issues related to people getting, and this coming back to, the importance, this was done in the context of research around mental health and people accessing mental health services. and cannabis potentially being used to treat certain mental health problems, anxiety, et cetera, in the right circumstances, and people not wanting to seek those treatments because of concern for what cannabis use might do to their family relationships. And then on the other side, not wanting to admit that they might have a cannabis use disorder precisely because of the stigma they might face. So these came really through in like in-depth conversations that we had in focus groups and in other work that I'd done in interviews. So in terms of the data, my main message is I like to have strong quantitative data that can capture the experiences of a broad number of people, and then contextualize those with the voices of the individuals who have been affected, and to get those perspectives, because those stories are very, very powerful.
Thank you, Akwasi. Jules, in your work and in terms of your vision, what do you think about some of the risks that researchers like Akwasi and yourself need to be sensitive to in the collection, analysis, and dissemination of data to combat the shame and stigma associated with substance use and recovery?
Well, thank you. First of all, I just want to support what Akwasi is saying about the importance of mixing methods and using a variety of data sources, qualitative and quantitative, I think are really important. But I think that the biggest thing researchers can do to avoid some of the pitfalls of this kind of research or any kind of research is really work in close collaboration with people directly impacted from the very beginning, in terms of what are the research questions, what's the research design, all the way through the data collection and the dissemination. Where I see both researchers and frankly policymakers really going in the wrong direction is when they fail to do that. And you end up missing really important information, but you also end up, when it gets to policymaking, to having some unintended consequences that could have been foreseen if only you had talked to people that are on the ground and directly impacted. And there are lots of challenges to doing that work and doing it well. But I think as researchers, we need to really dig into a lot of creative methods around community-based participatory research. And there's lots of people doing interesting work on how to do that more effectively and more richly. But until we're really meaningfully involving people directly impacted, we're going to miss stuff for sure. So that would be my biggest plea, I guess, is that we really involve people directly impacted. The other thing I want to say is that we sometimes, as researchers, fall into this us and them dichotomy that's absolutely false, right? This notion that we are studying those people. In fact, many people who study drugs and many people have a history of drug use and substance use. And because of stigma, not that many people are able to come out about that. So Sean, kudos to you for being so public about your own history. And I'll just mention a group that we started with some other folks. It's called the Network of Drug Researchers with Lived Experience, which is really a place for people that are doing drug research who want to talk about how their own experiences impact their research, to talk about that in a safe space. Now, the only reason we have to do this sort of closed door private group, right, is because of stigma. But what's true is that people with lived experience have not only particular insight into how to ask the questions, but also may have deeper connections in those communities, may be more effective at outreach, certainly have a leg up on how to interpret the data. So again, involving people directly impacted, and also recognizing that many researchers do bring that lived experience to their work, and that should be celebrated and valued as much as we can, given the stigma that surrounds it.
Thank you, Jules. Sean, some of what I'm hearing now, and certainly our research seems to display, the fact that society shows a lack of empathy toward people who use substances problematically. And one of the things that surprised me is that we saw healthcare workers report high levels of perceived substance use stigma, which could translate into reduced empathy in practice. How might we think about addressing this seemingly lack of perceived empathy in research, policy, and programming. And any insights you can share on the health worker context would be super valuable. Thanks.
Yeah, I think that's a really important question. And it's interesting because the example Jules let off at the beginning, somebody with an abscess and gangrene and not feeling comfortable going to our healthcare settings, is a real issue, and it still exists. And it's interesting because I'm now involved in training and educating healthcare professionals and also law enforcement. And I see the same attitudes in our healthcare systems as I do in law enforcement. In fact, I feel more comfortable today speaking in front of law enforcement groups, and some have very problematic attitudes and are doing tremendous amount of harm. But there has been a shift in those groups. And I feel more comfortable in front of them than I do in front of my healthcare colleagues, because I feel more, shame and stigma and judgment from them. Some of that may be my own sensitivity, but I know from my work in the hospitals historically and now today that those attitudes are extremely harmful, and the stigma that exists there is a huge barrier. And the reality is, nobody with a substance use disorder wants to go to the hospital. Nobody who's experienced an overdose wants to go to the hospital, and that has to change. And this is one of the drivers for this whole initiative to study stigma, to look at the attitudes, pull them apart, look at people's perceptions, and understand why they believe what they believe. And the reality is, there's so many myths and misinformation out there. Even highly trained, physicians and nurses and this entire healthcare workforce has the same beliefs, and in some cases worse than actually the general public, which is really dangerous and harmful. And I think, there's a lot of ways to deal with this. I think education and training is important. I think, like Akwasi said, storytelling can be really powerful, but and there's a lot of different storytelling initiatives to address stigma, but I always say stories can be very powerful and they can lead to change, but they can also be very problematic. And I know from my own experience, they can also trigger a lot of shame, within the individual, right, telling the story, and they can do a lot of harm. And we don't think about that enough. And I also think sometimes you tell a story, even a powerful story that moves an audience in a healthcare setting, and people go back to doing what they do. They're working in this machine that is just operating. And I always say, and there's some great people doing great things in healthcare around addiction, but the vast majority, we need real change, because they're operating in a system that has been designed to be punitive, and has been designed to hurt drug users, whether through judgment or shame or not. The reality is, you can't go to the hospital and get a clean syringe. In many hospital institutions, you cannot get Narcan. In many institutions, you can't get medications for opioid use disorder, or it's a real challenge. And many hospitals today, are waving the flag and saying, look, we got all our clinicians waivered, right? Now the waiver system's changing, but the reality is, most of them don't use the waiver. They won't even prescribe. They don't want to deal with people like us. And that's something that really needs to change. And that's going to take a lot of work, and it's going to take education. And I also think, through research, closing that social distance gap is the key. And the reality is that, people who are struggling or are in recovery have these attitudes about how they're going to be perceived. And the providers on the other side have these attitudes. And there's this huge gap, right? There's this huge gap. And we have to close that. And we have to find ways to close that. And I think, to Jules' point, integrating people, and I mean empowering people that have been impacted, whether through the criminal justice system or just they're in recovery and they've struggled, or they're currently, struggling, having them at the table, making decisions, involved in research, crafting hospital policies, right? They need to be there making decisions along with the other leaders in the institution. And the vast majority of the time, they're not. And I think that's that's something that really is hurtful. And it's interesting because I was listening to Akwasi's TEDx talk the other day, and he had so many great points, but something that really stood out to me was this idea about, law enforcement, and I work with law enforcement, that had criminalized, was waging a war on drugs, arresting people for cannabis, putting them in jail, right? Giving them, a criminal record that carries on through life. And now many of those people that did that are now shifting, and they're involved in the marijuana industry. They're investors. They're running these programs, and now they're profiting, right, off of that. Well, what about the individuals like who have been impacted? And I see that in the addiction space, in the substance use space, right? There's a lot of law enforcement, and I believe people can change. And I think it's really heartening to see so many law enforcement professionals moving to a more compassionate approach and doing work. But many of them are running addiction treatment centers or running programs to address substance use disorder after spending 30, 40 years criminalizing and destroying people in communities. And that's something that just stood out to me, and that things like that have to change. And I'm probably rambling a little bit here, but
Sean,
anyhow,
it's good. It's good rambling. And
can I make an observation based on something
please.
that Josh just said too? I find it so interesting. I work a lot with law enforcement as well, and it's central to the research that I do. I have quite close connections to people who are in medicine and doctors, and it's interesting that these two professions who work frontline so very closely with people who have substance use issues perhaps, and are using substances perhaps in a problematic way, and deal with people who are in mental health crisis, work in professions that don't allow them to talk openly about their own struggles with mental health and with addictions, right? In the world of policing, the culture does not allow for police officers to share their struggles with mental health. Within medicine, of course, if you share your mental health struggles and your addiction struggles, you risk losing your license. And so we have these individuals, and I'm thinking here about social distance, right? Like these are professions that for so long have not been able to be open and honest about their own struggles, and therefore don't know about the struggles of their peers, their colleagues, their coworkers, right? And so they're working on a day-to-day basis with people who are facing problems, yet they're not able to be open about their own problems. And I wonder the extent to which that exacerbates some of the issues that we see in doctors and police officers. And let's be honest, there are a lot of doctors and officers who work very well in these settings, but there are many that also don't. How different things would look if these professions were able to be honest about those struggles.
That's a critical point. I actually run this physician support group, anonymous, confidential. Doctors in recovery, doctors that are struggling with mental health issues, substance use issues, they hide. They hide when they're struggling, and they hide when they're recovering because they cannot speak openly. It's this culture of silence, and they suffer at a greater rate than the general population. They commit suicide at a much higher rate. They struggle with these mental health issues. They do not feel it's not safe. Their jobs at risk, their licenses at risk, the medical boards, there's these professional health programs, intensive monitoring, more intensive than the criminal justice system. And it's embedded in the culture, and it's really destructive, and it does nothing for, they always, it's always framed as we're protecting the public. But if you're really protecting the public, why can't people speak openly about themselves and their struggles, or the idea that maybe they use substances? And I know plenty of doctors. I use drugs with other doctors. Doctors use drugs. Lawyers use drugs. Other people use drugs. I mean, it's that's a really important point, Akwasi.
Thank you very much, Jules. You're at the front lines of this in many ways. Are you detecting a note of a thread of optimism? Is there something you're seeing around you now that is sort of a good news signal to address some of the concerns that Akwasi and Sean are speaking to?
Well, I'm generally an optimist, except when it comes to drug policy. But I will say I do see signs of optimism. I mean, one of the things that this conversation I think is illuminating is that The impact of stigma on individuals is really profound and really devastating. And I'm glad that there are programs to help people cope with that. But until we change these sort of punitive, overarching policies and structures, I don't think we're going to make real headway on stigma, right? As long as we're treating drug use as a crime and a moral failing, it's going to be really difficult. So where I do see signs of hope are in things like the legalization of cannabis, right? In this country and in Canada and in other places. The passage of Measure 110 in Oregon, which decriminalized possession of all substances, right? And set up a very robust infrastructure for people to get support and help if they want and need it. So those kinds of things I think are really hopeful. The other thing that I want to just raise, because I think it not necessarily a sign of hope, but maybe a cautionary tale that we haven't really addressed, is the role of white privilege and racism and how we understand drug use and stigma. And so that in the US in particular, we see the opioid crisis sort of coded as a white problem. You do see, right, in the media and in the public policy arena, a softening of language. And it has to go back to this thing that we were talking about before, this notion of somehow white opioid users are innocent and blameless, right? Because maybe they got hooked on prescription pills or whatever. So one of the things I just want to sort of say is that I think when we're talking about stigma and policy change, we also have to be very attentive to the ways that race and racism are entangled in these narratives, because it's not all drug users who are stigmatized equally, right? Some drug users we will hold more blameless and treat a little more gently. But again, that's why I think it's imperative that we really, if we really want to see change, that we look at the policy and structural level and undo, right, 50 years of just brutal, draconian, punitive policies that are not just in the criminal legal system, but again, cut across all of these systems. And so where I see hope and optimism is all of the hard work in trying to undo that. And then I also think that we are seeing more people with substance use problems or not problems, just substance use, willing to come forth and share their stories, because I do think that's another really important, powerful tool of change, is that when you understand that people who use drugs are your friends, your neighbors, your family, it is much harder to adopt those really punitive attitudes and policies.
Thank you, Jules. Akwasi, are you seeing any signs of optimism in the Canadian landscape in particular?
I am. So, with respect to the opioid crisis here as well, I think, unfortunately, it's got to the point where it's touched so many people that, kind of the reality of substance use is hitting home for many more people. And I think that that's going to be a driver of policy change. I sat last spring on Health Canada, which is our federal health agency's national expert task force on substance use. And we developed 2 reports, one looking a little more backwards with respect to kind of criminal penalties, and one just kind of like looking where our drug policy should be going. And the expert task force recommended the decriminalization of all drugs at the national level in Canada, and made some strong arguments towards the development of a legal framework for the provision of drugs as we have for cannabis now. So I think that both of those are very positive. Jules had mentioned decriminalization with respect to other substances. We have in Canada as well medical provision just starting for psilocybin for people who are experiencing end-of-life distress. Jules mentioned that the emergence of the legal cannabis industry is doing something positive to change our perceptions of drugs and drug laws. And I think the same will be true as the burgeoning psychedelics industry, is more prominent, more prevalent, and takes up more space. And so, the prohibition of drugs is a historical aberration, right? We're existing in it now, but it's a little over 100 years old, really, in the West, right? Like federally, opium was outlawed in 1908 in Canada. cannabis in 1923, right? We're looking at the early 20th century in the United States as well. So for most of human history, drugs were not illegal, right? This is a very recent phenomenon. And I am quite positive that by the end of my academic career, we will exist in a very, very different policy and social and cultural landscape than we do now.
Thank you, Akwasi, for that insight. Sean, a note of optimism, something you're seeing in your context that makes you feel a little bit optimistic about the future.
Yeah, I mean, I would agree with both Jules and Akwasi. I think, there's been a huge shift. I think here in the U.S., not only, statewide, but federally, there's been a pretty significant shift. Even the Office of National Drug Control Policy, which is, a very supply side focused, organization. There's been some heartening things around harm reduction, investment in harm reduction, even though it's small, which I think is really exciting. I think we're looking, and there was a recent article, I think yesterday in the Washington Post, talking about this, just the shift in this country, looking, the overdoses, and the suffering and the trauma from the overdose crisis is getting attention, and people are starting to consider things that they never would have before, so things that center people impacted, and protect the health and human rights of people. And I think, like Jules was saying, I mean, this has been going on for so long, and I think, it starts back with the single conventions, 61, 71, and 88. We had these conventions that were, this framework, and then, Nixon really, took it and ran with it in this country. And I think those are shifting. And it's interesting because I was recently involved in this program that was in Geneva on drug policy. And there, we were talking about the drug scheduling system and how problematic it is. And they were really debating, like, do we need this? Like, are these systems causing harm? And I think not just here in the country, but I think globally, there is a huge shift. And I think we're also looking overseas. We're looking at places like Portugal and Switzerland. And it was fascinating because there were a couple individuals there that were involved in changing policy in those countries. And they were describing their countries before the policy change, and it sounds like America today. Like the description was so vivid. It sounds like Kensington, San Francisco, these different new parts of New York. People openly injecting, the hopelessness, high crime, like all of these different things. And then over, a couple decades, the shifting policy of putting health and human rights, at the forefront. And what an amazing impact it is. Criminalization is down. People with substance use disorders are down. And I think we're moving in that way. We passed legislation in Rhode Island to allow, overdose prevention sites. I think New York is, toying with that idea. We've had some issues here in Philadelphia about that, even though we led the pack. But I think some of these ideas that we would have never entertained even a couple of years ago are now being discussed as real strategies, which is, I think, really, really exciting. I still think we have a long, long way to go and a ton of work to do. But I think we are making progress, and I think there is hope.
Thank you. Thank you. So this is the last question. It might be the toughest question. Jules, and I'll ask you first. If you could leave our listeners today with one piece of actionable guidance, something simple on how to do something or maybe stop doing something in terms of how we interact or talk about substance use stigma in the short term, somebody wants to make a difference, simple difference that's meaningful, what recommendation might that be?
Well, that is a tough question. I'm gonna just give two answers for those people that are sort of activist oriented and minded. I would say support policies that undo the criminalization and notion that drug use should be penalized, right? So that's things like all of the things that we've just been talking about. On a more interpersonal and personal level, there was a campaign in the UK that I loved that was "Be nice to people who use drugs." And it's really that simple. Like, we need to let go of all of the socialization and cultural stereotypes that we have about who drug users are, and just treat them humanely and kindly and compassionately. I really think on a personal level, it's that simple.
Thank you, Jules. Akwasi, how might you think about that?
I'm going to take a big picture approach here, and it's along the same lines, I think, as what Jules has just said. I want people to think about the policies as the problem and not the people, right? It is, we have a problem of policy and not a problem with the people who are on the receiving end of that policy. I want to mention just a couple of other things as I conclude here. One, just a quick plug for the book, of course. It's currently titled Waiting to Inhale, Race, Cannabis, and the End of Prohibition. It's under contract with MIT Press and should be out in 2023. And it details some of the work that's been alluded to here. And the second thing that I will plug, because Jules didn't, is the DPA's reform conference, which I understand is on hold for the moment. But as far as I'm concerned, someone who's been to a variety of different conferences where issues of drugs and substance use and stigma has been discussed, there is no place that I've been where I've found such an open, supportive, and broad thinking group of people come together in one place in America to discuss these issues. So that's a plug for the DPA and their conference.
Thank you, Akwasi. Sean, any simple, maybe, or non-simple piece of guidance? Thank you.
Yeah, I'm going to add a couple things. I mean, they're really in line with what Akwasi and Jules said, but policy is the issue, and I think as a society we need to use our voice and speak up. I think there's so many different. First of all, almost everybody's been impacted in some way, shape, or form, and I think we need as many voices as possible speaking out about these issues and advocating for the decriminalization, not just of drugs, because we haven't just criminalized drugs, we've criminalized the people that use them, and we've criminalized many of the strategies to address these issues. So, decriminalization, is a huge one. And lastly, we are human. Like we are human beings, people in recovery, people that are currently using drugs. We're human beings. Treat us as equals. We deserve to be treated as equals. We deserve to have our rights honored.
Thank you.
And that doesn't happen today. So.
That's such a profound point, Sean. I just like to wind this up by just expressing my gratitude to all three of you for joining us today on the Quiet Voices podcast. And educating me personally. Sean, well how you personally educated me about addiction. It's a topic I thought I knew something about, and it was really only through you that I learned about it. And I'm frankly just on the beginning stages of that journey. So I'm so grateful to all of you for joining.